What's going on, everybody? I'm Josh Throne here at MD Hair Labs with Dr. Lance Manning. Doc, thanks for joining us today.
Thanks, Josh. Appreciate it.
So today we're going to be talking about the differences between FUE and FUT. A lot of people out there who are just now entering kind of their search for a hair transplant, they see those terms online and they don't even know the difference. So could you explain that?
Sure. FUE is a follicular unit extraction, and basically it's talking about the way that the hair follicles are harvested from the back of the head and the sides of the head sometimes.
Right.
Follicular unit transplantation is FUT, but it's more classically known as a strip procedure.
Gotcha.
And so essentially, FUE uses a tiny, tiny needle-like incision to harvest individual follicles.
Right.
Now, a single follicle may have 1, 2, 3, 4 hairs in it, but it's a single follicle, tiny, tiny incision, where an FUT is a long strip incision.
That's why you see the scar on people's heads sometimes.
That's it, you got it, yeah. And so, I mean, there are some advantages to each of them, but some limitations too.
Right, so I think a lot of people out there when they're searching, and I remember myself searching for a lot of these answers, when you see the word graft and they talk about, extracting a graft, they're thinking, okay, what is that? And then you find out it's a follicle, and then each follicle could have multiple hairs in it.
Right.
So when you're doing the different procedures, an FUE versus an FUT, how do you know how many follicles you're getting or you're going for? How do you determine that prior to a procedure based on each one of those?
So sure, there's the difference between what someone has as far as their harvest area. And generally the harvest area is the back of the head. Sometimes it can extend onto the sides of the head, but it's going to be in this area that's not really prone to male pattern baldness, okay? And when we're looking at how many we need, it really depends on how bad the person's hair loss is.
Gotcha.
And we look in sort of these areas along the frontal area, what we call the temporal areas, this mid-scalp, the crown or vertex, and basically we just do some math. We've got some advanced techniques and technology where we can actually physically count the number of hair follicles and hairs, right, per square centimeter, okay? We figure out how many we need to place to where it looks natural, where there's good coverage. Now that varies from whether we're talking about the frontal hairline, the temporal areas, more on top of the head, the crown. And so we look at what they're missing, what we want to get to that'll look natural in them and age appropriate. Also it depends on what a person's stature is.
Right.
A tall person, really we're thinking more about what's going to go in the front. People much less commonly see the crown. Someone that just has crown loss and they still have good hair up front, it's going to vary. So we'll measure the area we want to take and transplant to. We'll look and see how many hair follicles that they have in the good donor area, and then we just do some math.
So all of that kind of adds up to you determining what type of procedure you want to go with, whether it's an FUT or an FUE?
To some degree,
Okay.
Only because FUE is really limited on the top end. If you've got a guy that has nearly a sort of a whole horseshoe, to
Right.
use common terms.
My dad.
Right? You really are limited as far as what you can do in a single procedure with FUE. Because you're going to take with FUE, you're going to harvest individual hair follicles, as we talked about. You've got to leave enough, one, where it still looks right. You don't want it, if it's over harvested, and we've seen those,
Right.
particularly some that have been done abroad and then they come back and they're over harvested and they look patchy, it looks
Right.
terrible. It's actually really hard to fix. If we're limited on what we need, if we need a whole lot, then probably an FUT is something, if they're going to do a single session, we're going to lean towards. If not, then we really prefer the FUE technique. Typically there's less pain, somewhat lower risk of complications,
Right.
certainly not the big linear scar.
So you hear a lot in this world, at least working up here in the front and being kind of front facing with a lot of the patients. I see a lot of female patients who might come in. And
Sure.
They're ones that we kind of end up leaning to doing the FUT on a lot.
Sure.
So why are we pushing more when it comes to a female patient, or I guess why are we end up leaning more towards the FUT? What are the benefits?
Well, one, most of the time, the female patients are much more likely to be okay with a linear scar.
Right.
Many of them say, hey, I'm okay with not having hair that's short in the back. They'll never see it.
Right.
The other thing is with the FUT, in the strip procedure. If we do that, we can leave the hair the normal length.
Gotcha.
We don't have to totally shave the hair, depending on what FUE technique we're using, but with the ladies, we can just take part their normal hair, take that FUE or FUT, strip to take the grafts from, right? They're still candidates for the FUE if they want that, but certainly a guy that wants to have short hair and doesn't want a scar to show ever, FUT is not the best for him.
So after the follicles are harvested, most of the procedure is basically the same, either way. It's really determining the initial harvesting, whether taken by strip or taken by individual unit.
Because what you do with that strip of scalp is what it is. Under a microscope, we'll take and separate those follicles apart.
Gotcha.
Right? And it's the same thing. We're going to separate them into, 1, 2, 3, 4 hairs, and that's going to determine where we put them.
Gotcha.
For example, we're going to be really strategic with FUE or FUT in putting the single hairs generally along the front.
Right.
We're going to go, a couple of rows back with that to make it look very, very natural, to frame the face the way it's supposed to, so that people can't tell that was done. And then we tend to use the follicles that have more hairs further back to give us some fullness and body behind there. But whether we start with FUE or start with FUT, the implantation, which is when we put those in, is the same.
All right, so both of these different procedures obviously have different challenges as a physician.
Sure.
So what are those? What kind of issues do you run into?
Absolutely. Well, first, there could be some scarring, though honestly, much less so with FUE than FUT, as far as there's no linear scar. With FUT, there's the additional risk of there being some nerve damage. There are some nerves that come up from the neck that we call innervate or give you some sensation to the back of your head. Okay, and there's some large blood vessels that run with those. So if you don't have someone that's frankly a really experienced surgeon to take and harvest this, then there's some real risk of nerve injury, where people would be, we call insensate in medical terms, which basically means can't feel.
Got it.
Right? Also the risk of bleeding if you happen to get into one of those big vessels, which fortunately we've not had that happen around here. We've not had any patients that have been insensate. But as far as the harvest, those are things that we think about. If someone has the proper preoperative evaluation, and you will take and make sure that their skin is right, their medical history is right, the risk of complications from either technique is really low. But we also don't harvest from just anyone. You want to make sure that they're going to be a good candidate, that they're not prone to scarring, or frankly, they don't have a type of hair loss that if you harvest hairs from here where they're, going to last, that they don't have a skin condition or a hair condition, or, for example, there are a number of autoimmune conditions that'll make those hairs not work when we transplant them.
Right. So if you're at home right now and you're trying to figure out which procedure is best for you, the FUE or the FUT, my first advice would be consult with a physician like Dr. Manning to figure out what's best for you. If you don't have a physician to consult with, we encourage you, go to mdhairlabs.com, set up a consultation with us, both in person or virtually, depending on where you're at, and we look forward to helping you on your hair loss journey.